Just to kind of round up and finish off, is there anything else that you would like to add in terms of both your context, but maybe even what you're seeing or hearing from outside Wagga around these sort of common themes around workforce and complexity?
I think it's a very common theme amongst doctors, parents, teachers. Everyone's talking about the same thing, the difficult to access care and just the desperate help that's needed for our next generation. I don't know if I could say much more. I think we've heard it really, haven't we? You know, it's just a really important issue that we have to sort out, because otherwise we're going to run into even more problems than we already are.
Yeah, I think I would echo that as well. You know, our kids are the future generation, right? So we've got to do everything we can to support them early on. We know that what we do in the early years, particularly, you know, you hear the under fives and the brain development, what we can do early on is going to change their lives, and this is the next generation that's going to be, you know, coming through. So what we do now makes a big difference.
I agree absolutely with those comments, and I'd add that I think through being able to do more locally would make those opportunities even better or greater. We can have a much bigger impact because we're there. We're seeing. We're working even more closely with, you know, paediatricians. But you know, as we've talked about, we can speak to the schools, we can speak to the nurses on the ward or whatever it might be, or the local speech pathologists, and you know, as you'd all know, those relationships are so important, but also we can see some of those interactions between health and child safety and mental health a bit better. I think if we're out there in the community, I think we have a strong presence with what we do, but I think we can do that better and have a much bigger impact. And, you know, just to keep in mind, for some of the regional centres, I think the wait lists are probably 2, if not 3 times what it is in Wagga, and I'm not dismissing how difficult it is for you. And I think us being able to really support those local clinicians and the kids much better is such a wonderful opportunity. So that's hopefully where we're heading.